The Grand Challenges Canada grant is for a Rising Star in Global Health for a project working with Guatemala. And it's a project to treat diarrhea using zinc and ORS. ORS is oral rehydration salts. And the project is really an initiative that was created through our existing relationship between Micronutrient Initiative and the Ministry of Health in Guatemala. The Ministry of Guatemala and the Ministry of Health specifically has been really committed to scaling up zinc and ORS for the treatment of diarrhea. And they've gotten to a level where, most health centers now have the supply. The supply issues are getting worked out. But one of the things that we're less sure about is whether or not, how mothers are using this product once it gets home. And even among the providers themselves, the nurses, the doctors, and the local health providers, they're less clear on how to use it or what counseling or what advice the mother needs, especially around getting the mother to continue giving it to her child once the diarrhea symptoms go away. It's also important that she still knows how to use the ORS, and that's kind of the focus of the project, to look for ways to ensure that this is used well at home and that the mother does in fact know that these need to be taken together. And that, to start with, really getting a packaging. Zinc and ORS in the Guatemalan system show up as two separate products in the health system. So the idea is, if they go in some kind of co-package, that'll serve as a first place to ensure that at that health center, the provider gives them to the mom and explains how they're used together. And then also to put messages on the box based on what the mothers tell us their current experiences for how can we help her to know how to give this to her child when she brings it home. So the idea is to really look at a creative kind of co-packaging, to test it with the moms in the communities and develop a product so that there'll be more clarity on how to use the zinc and ORS at home. Behaviour Change Communication is really about identifying the barriers and enablers to getting any intervention down to the ultimate user, which is often the caregiver. So in some cases, those barriers might be the knowledge, the attitudes that a community or the mother herself might have towards an intervention. In some cases, it's the actual practice and what people are doing, and maybe there's something else that we want to promote them to do in order to increase their health or the health of their child. And in some cases, it's at the policy level. For example, maybe women have trouble accessing a health service, but we'd like community volunteers to be able to distribute something like vitamin A. So it might be working with the Ministry of Health to get those policy changes done and to see if that actually can be done safely and if that is possible. So it's really looking at all those barriers and enablers from up to the policy level to the provider, whether it's a health volunteer, a health worker, a doctor, or a nurse, and then down to the caregiver, as well as all their other family members and influencers such as communities that may or may not be telling them other things to do or giving them advice. I think in order to influence someone's behavior, it's really important first to understand what their current behavior is, why they're practicing that, and what their beliefs are. And sometimes it's what would they like to be doing, but there's often other barriers. So I think our first step is always, formative research to learn from someone and to see what their current situation is. That could be a healthcare provider, why they're doing what they do, what other tasks they have within the day, what type of training they have, what is their knowledge, and how is their priority for this intervention in comparison with all their other tasks that they have. For the caregiver, that's the same thing. We have moms often, very busy, often have many children at home. So in order to make, an hour trip, sometimes an hour walk, to go and get treatment for one child for diarrhea, that mother really has to believe that that's a priority when she may have to leave other little ones at home, cooking, other responsibilities, agricultural duties. So for us, it's really understanding, what are we asking of the mom when we suggest the intervention, and what would be a motivation for her? What would really motivate her? What benefits of this, this potential micronutrient intervention, whether it's zinc and ORS for treating diarrhea or iron folic acid for herself when she's pregnant or lactating, to know, what will really make this intervention meaningful for her. So I think that's our first job, is really to figure out what motivates people and what are the real barriers. Sometimes it's access, sometimes it's knowledge, awareness. So we really need to figure all of that out first. I think generally often as human beings, we're often resistant to change overall. So I think it's always a process, and it's really identifying often who are those people who might be willing to try it first, what will motivate them, and more than anything, we have to really understand people's current experiences with health systems, with interventions, with, in the case, with the health outcome, with diarrhea, what are their current experiences? If it's, something for maternal nutrition, what's their current experience with pregnancy, with delivery? So we need to really understand their current situation with respect to any intervention, and then that can really help us design messages to figure out, how can we motivate a few people to be the first ones to try it, to share their stories, and then, to get this appeal to more people so that it really can be a sustainable intervention and to create local demand for it. I think one of the most successful strategies is really having those community volunteers, whether it's health extension workers who may be part of a government system, or if it's the female community health volunteers. In India, they have the ASHAs. These are the women who know the women in the community and can get the products that extra mile, and can also give them the advice in a way that they'll understand it. So often with those kind of models, the extension workers receive training. They may be given some kind of uniform, promotional materials, but they're really, physically, in some cases, physically distributing either micronutrient products, or they may also be referring the mother and encouraging her to go to the health center. So they play a critical role in really getting people to go to the health center, and also sometimes in some contexts where it's the policy for directly providing services and treatment to caregivers for their children, and sometimes directly to the mother as well for pregnancy. I think there's a really interesting example in Senegal, and I think this may be the case in other places as well, where they realized they'd been giving messages directly to pregnant women for quite some time, and even women with young children around infant and young child feeding. But they realized that it really, as much as they gave the information to the mother and she really understood the messages, it really wasn't her complete decision, because the mother-in-laws in that context were so influential. So one of the interventions is, really working with those grandmothers. And now those grandmothers are the ones who are receiving the messages, because they're ultimately the one influencing the young mother, the pregnant mother. So I think a lot of cases it's realizing that sometimes we don't target the caregivers directly, but we also need to target their social support networks and their influencers. And those grandmothers have become, quite powerful and meaningful. And in the traditional knowledge system, they were already quite influential, but now they're also being targeted with the public health messages, and they're being supported, and they meet at local health facilities with the Ministry of Health, and they have their mothers groups meeting, and that's where they're learning about nutrition, and then passing this on to their daughters and daughter-in-laws. So I think that's quite powerful, looking at an existing social support system and working with those grandmothers.